Audio Jungle. Audio Jungle.
Okay, start.
Hi everyone, myself Dr. K.C. Misra. I am the head of the critical care unit at Yashoda Hospital, Somajipura. So basically it's regarding the course of one of the sickest patient what we had last month. This is Srivan. She is like 54-year-old female. She came to us from here, Warangal. Actually she was having severe pneumonia. Both of the lungs were very severely affected. So she was not maintaining her oxygen levels with best of the supports whatever she can receive. After 2 or 3 days of maximum possible effort, as she was not maintaining, she was shifted to our hospital. And we tried our best overnight, but things never improved. Then next day itself we have to think of starting the one of the sophisticated way of supporting a patient when their lungs are not at all supporting for oxygen levels. That is called extracorporeal membrane oxygenation or ECMO. ECMO is one of the, you can say, life-saving instrument or a procedure that can be done in patients where lungs are failing with all the possible supports if oxygen levels are not maintaining, or heart is failing, or both heart and lungs are failing. In these cases, we can think of starting ECMO. This is maybe the most sophisticated way of maintaining or supporting the heart and lung at this point of time in the whole world. We are one of the institute, that is Yashoda Hospital, Somajipura. We do one maximum numbers of ECMO, let it be in Hyderabad, and one of the maximum numbers ECMO in India with very good success rate. One of the success patient is there with me right now. So, because you see, whenever we are thinking of extracorporeal membrane oxygenation, so the main thing is lot of people have a doubt that, see, lot of big shots in India who have kept on ECMO, they never survived. So all the people, common persons have a perception that if you start an ECMO, nobody is surviving. It's not the case. In our hospital itself, almost 60% of people who are put on ECMO, they survive. One of the live example is with me. So that myth, that the conception of the people should change. If somebody is dying because they are not able to maintain the oxygen with best of efforts, or the heart is failing to a level that they are not maintaining their blood pressure and other organs are getting affected, that is the time we should think of it. Our institute is one of the institute pioneer in ECMO right now, where we have all the facilities and support staff to initiate an ECMO. ECMO cannot be done in a place where the people are not trained in, and it requires multi-speciality effort to start an ECMO and maintain a patient who is on ECMO. Second, see, ECMO, one of the important part when it comes to ECMO is to start early in right patients. If we are not starting early and we are starting late, the outcome with ECMO is not going to be that good. Most of the time what is happening is, we know that ECMO is a kind of costly affair. A lot of people cannot afford it. So that is the reason sometimes it gets delayed. But if we are delaying ECMO, even a day, delay costs a lot of issues, because see, life is more important. If you start ECMO after 4 or 5 days of admission, their chances of survival is very less if you start early. So we need to start in right patients. Let's say somebody is not at all maintaining oxygen levels, or their heart condition is so bad that with all the support they are not maintaining. At the time we should think of ECMO and start early. If we start early, like Mrs. Srimani, we started early. So without wasting much of time, within 12 hours or 14 hours of her admissions, when she was not maintaining, already she was treated outside at Aditya Hospital. Rohita is going to talk on that. We initiated, and because we initiated early, we could remove ECMO within a period of 6 days. Usually, when we start ECMO late, these people may require ECMO for a very long time. We have some patients where the ECMO is continued for 30 days, 40 days also. So it is very, very important that if the support is available, the team is available, you have the experts available 24/7. We should think of ECMO in cases where they are not maintaining or sustaining with all the possible life support. This is one of the life support we can say that the end, maybe the final life support what we can give at this point of time in the world, and we should start early. So I think with that I will ask Dr. Mohita to tell her